good, everybody? I'm Dr. Jaslyn Adams, and welcome to Hey Dr. J, where we cover pharmacy basics one topic at a time. Think of this as an online FAQ for things you'd usually ask your pharmacist. Post your questions in the comments below on this topic or a topic you'd like to see, and I'll try to answer them to the best of my abilities. So, to get this project rolling, let's start with a warm-up. High blood pressure, aka hypertension. To put it simply, this is the measurement of how hard your blood vessels are working in order to pump blood through your body. I'm covering this topic first because it's important to me as an African American. It's one of the leading causes of death globally each year, and it doesn't always come with typical warning signs. It is known as a silent killer, and most people are on one, if not two, medications in order to treat this. So, to know what to watch out for, I strongly recommend going to the American Heart Society's page for more details and other recommendations. The link is shown below and will be in the bio of this video. So let's set this up. Say you went to see your primary care provider for a routine checkup, right? They notice that your blood pressure is a little high. Now they want to run some tests, ask you to get some blood work done, and then they send a prescription to your pharmacy that they want you to take for a few weeks, if not months, and then come back in for a follow-up. So you leave there, and let's say maybe the initial shock of getting this information is starting to wear off, and now you got all these questions coming out. What does this mean for me now? Isn't this where you have to cut all the salt out of your diet? How am I supposed to eat without salt? Am I going to die soon? Do I have to go vegan? I don't want to go vegan. I really like sugar. Here are the meds you're going to see most often out in the pharmacy according to the most recent blood pressure guidelines, and we're going to discuss them by class. First up is a group we call ACE inhibitors, angiotensin converting enzyme inhibitors. ACE is an enzyme released in your body in order to narrow your blood vessels. So, these medications prevent that enzyme from attaching where it needs to go, so your blood vessels can't narrow, and then your blood pressure goes down. There's quite a few ACE inhibitors available. You'll see medications like lisinopril, ramipril, and enalapril. Notice how all these end in pril. Their doses can range between 5 milligrams and 80 milligrams, and some people do respond to one drug better than another. So make sure you discuss with your provider any differences that you notice or changes in your body as you go throughout this journey to control your blood pressure. Now, let's discuss side effects, the medical world's favorite two words. For ACE inhibitors, the most common side effect is a non-productive cough. What is a non-productive cough? It is basically a dry cough, for a lack of better terms, but there's no phlegm or mucus that is like heard within the cough, and there's nothing that's really coming off. It's almost like a itch in the back of your throat, kind of that thing, like when your allergies are acting up, but nothing's really coming up. It's just this nagging kind of thing that happens in the back of your throat. There's honestly no cure for this cough, and nobody really knows why it happens, but it does, and it can with this particular class. And if you are suffering from it, or if it's driving you up the wall, because this can happen a lot at night, the best thing to do is either treat it with lozenges or change to another drug class, which we will be discussing later. Next side effect is angioedema. This is a rare but a big one that I kind of want to put a pin into and discuss in a little more details, because if you're African American like me, that risk of angioedema happening gets a little bit higher. It's actually to the point that ACE inhibitors are not ideal first-line treatment for African Americans. Yes, there's another class that we do recommend, and yes, I will discuss this a little bit later. Angioedema is defined by swelling under the skin. It can technically happen anywhere, such as your face, your lips, your arms, but big areas you really want to watch out for would be your throat, tongue, and the abdominal region, which is like your chest and stomach area. We consider this big areas because if the swelling gets too big, it can close up and you can either have difficulty breathing or stop breathing entirely. When this happens, it can be a quick flare-up that goes away within a few minutes, or it can flare and spread. Both are situations you want to watch out for, and if it is spreading, you want to seek medical help. As always, please take this information with a grain of salt. If you feel you need to get medical help, please do so. Each medical case is different for each patient, and angioedema is not necessarily something you want to play with. If you do experience the swelling, don't panic. You can take a Benadryl and apply a cold compress and monitor. Cold compresses include ice packs, maybe wrapped around something so it's not directly touching the skin. It can include a wet rag, frozen peas, things of the sort. Other less serious side effects include headache, tiredness, fatigue, potentially more potassium in the body, which is why it's important to get labs done. And these drugs can be hard on your kidneys, which talks about renal function. So staying hydrated is vital not only for lowering your blood pressure, but also for your overall health. So please, drink water. No, the water in your coffee doesn't count. You need water. Also, if you are on these medications and you're not experiencing any side effects, or if you're in a tolerable place where your blood pressure is controlled, it is okay to stay on these medications. Always discuss any changes with your provider. Next class up is the ARBs, angiotensin II receptor blockers. These medications block angiotensin II, which is a hormone that is primarily made in the liver and it causes constriction. So when you are blocking this, it encourages dilation, which is relaxation of your veins and arteries in your body so that your blood can pump a little more normally. Similar to the ACE inhibitors, these drugs also have a similar name ending. You have medications such as telmisartan, olmesartan, valsartan, and losartan. Doses can range as low as 16 milligrams and as high as 300. Why are these doses so different? Ask and find out. Anyway, the biggest sale point, I guess, for this drug class is that they're very similar to the ACE inhibitors, but they don't cause that annoying dry cough. Or at least there's a very low chance of that cough happening. In general, this class is pretty well tolerated when it comes to side effects. It doesn't mean that side effects are impossible, it just means that the chances of any of them happening are fairly low and only occurred in about 2% of patients during clinical trials. That's like 2 out of every 100 people, which medically speaking is pretty good. Those side effects listed for ARBs include headache, dizziness, diarrhea, and UTI. Why UTI? Well, there's a theory that blood pressure medications encourage the body to release electrolytes from your bloodstream into the toilet. So if you're dehydrated, it can't get all of it out of your system and it can linger in your urinary tract, which causes infection. So what's the moral of today? Drink plenty of water. And make sure you wipe properly after using the bathroom each time, which applies to both men and women. These medications are also not ideal for pregnant women, just like ACE inhibitors, because they fall into the same categories per trimester. Interaction-wise, losartan has the highest chance of causing drug interactions versus some of the other drugs in this class. It is preferred to separate losartan from heartburn medications like cimetidine, which is called Tagamet, and is now available over the counter. Also, keep it away from antifungal medications like diflucan, which is also known as fluconazole. It doesn't mean that you can't take them, just like with everything else. Just try to separate them by about an hour and give your body time to run its course. So, that's 2 classes down. We have 2 more to go, but I am going to stop the video right here because I've given you a lot to chew on. And if you do have questions so far, I want to give you an opportunity to get those questions out. Blood pressure is a pretty dense topic, and I don't really want to leave anybody behind, just my preference. So, look out for a part 2, and I will see you guys next time. Stay safe, y'all.